I will be talking about public health efforts related to harmful algal blooms, and in particular, the One Health Harmful Algal Bloom System. Many of you are likely familiar with the concept of a harmful algal bloom, but for those who are not, I'll provide some brief background. Macroalgae and phytoplankton can grow rapidly or bloom and may cause harm to people, animals, the local ecology, or the local economy. These harmful algal blooms, or HABs, are supported by factors such as warm water and nutrients. Public health concerns primarily focus in on two types of phytoplankton and the toxins that they can produce. Cyanobacteria, sometimes called blue-green algae, and microalgae, the blooms of which you might know as red tide. HABs occur throughout the United States. Cyanobacterial blooms typically occur in freshwater settings, and microalgal blooms in marine or brackish water settings. People and animals are primarily exposed to HABs and their toxins through skin contact, inhalation, and ingestion. This could be from swimming or other recreational water activities, breathing in water droplets that contain toxins, or using contaminated tap water. Seafood can bioaccumulate and pass on HAB toxins when eaten. Dietary supplements or food that contain algae can become contaminated. Treatment is primarily supportive care to alleviate symptoms. Animals may be at increased risk of exposure or severe illness. Some of this might relate to physiology, but also to behavioral characteristics that differ from humans. Animal illnesses may serve as early indicators of a HAB or its severity, and also provide information about risks and health impacts of HABs. From a public health standpoint, there are still many questions about HAB exposures and the illnesses that they can cause. CDC works to mitigate and prevent HAB-associated illnesses in several ways. One of these is national public health surveillance, which will be the focus of today's presentation. CDC also develops health communication tools and resources to raise awareness and increase knowledge about HABs, provide public health-related technical assistance for preparedness and response during HAB events, and support state HAB program capacity building efforts. Additionally, CDC conducts health studies to understand exposures to toxins, develops diagnostic testing methods for toxins, and collaborates with state and federal partners through work groups and other activities. CDC looks at HABs through the lens of One Health, which recognizes that the health of people is closely connected to the health of animals and our shared environment. It is a collaborative approach that recognizes the benefits of many sectors and disciplines working together to achieve optimal health outcomes. So this next section will provide some background on public health surveillance through the One Health Harmful Algal Bloom System, or OHHABS. OHHABS is a nationally available system for state and territorial public health agencies, which can also designate user accounts to environmental and animal health partners, such as their State Department of Environmental Quality or Agriculture. It allows for systematic data collection about HAB events, human cases of illness, and animal cases of illness. Reporting is voluntary, both in general adoption of the system and for its components. For example, one state might only report HAB events, while another might also report human or animal cases of illness. OHHABS does not replace routine water monitoring, real-time investigation tools, or event response systems. So investigation and reporting may depend on a variety of factors. In the example shown here, people who become ill after a trip to the lake contact their poison control center, their health department, or a medical provider. Any cases reported directly or indirectly to the health department are interviewed, and the health department works with partners such as state agencies to collect and review other supporting evidence before entering data into OHHABS. This screenshot from OHHABS shows some examples of how environmental, human, and animal case data can be reported and grouped according to a single HAB event. On the far right, the numbers indicate how a single HAB event is linked to a human or animal case in OHHABS, with the number of human cases listed below the person icon and the number of animal cases listed below the dog icon. Reporters to the system review available environmental, epidemiologic, and clinical data and use OHHABS definitions to classify HAB events and associated human and animal cases. These definitions are considered using current scientific understanding and will benefit from refinement over time. Challenges to investigating and classifying cases include limited access to diagnostic testing for humans and animals, and sometimes to timely and routine environmental testing for HAB events. When this information is available, a challenge can be to interpret those findings as they relate to health effects. Next, I'll share some of our initial findings from the first 3 years of data reported in OHHABS. There were 18 states that we refer to as the early adopters of OHHABS. These early adopters reported 421 HAB events, 389 cases of human illness, and 413 cases of animal illness that occurred from 2016 through 2018. Although no people died, 369 animal deaths were reported. As expected, HAB events and cases of illness occurred most frequently in warmer weather months, with HAB events and human cases peaking in July. Overall, 90% of reported HAB events were freshwater cyanobacterial blooms. A large multi-month HAB event was responsible for 51% of total cases of human illness. A HAB event at a lake in May affected a flock of wild birds and accounted for 73% of animal cases. 88% of OHHABS reports included environmental testing results. The most common reason for conducting this testing was routine monitoring. Water quality monitoring programs can lead to early detection and notifications to the public. Citizen complaints in human health or animal health event response were also important contributors. Toxins were the most frequently reported result of environmental testing, indicated for 83% of the HAB events in which testing occurred. Within those results, microcystins, a set of cyanobacterial toxin, were reported for 94% of HAB events. Now, at least 39% of human cases were under the age of 18 years, and people became ill within a minute or up to 8 days. Healthcare seeking behavior was limited except for contact with poison control centers. And this was driven heavily by a single HAB event in which people contacted the poison control center, which was coordinating with the state. Of all of the human cases reported, 8% had clinical testing done to identify or rule out a cause of illness. CDC confirmed exposure to foodborne toxins in 4 people. Within the categories of domestic pets, livestock, and wildlife, the most frequently affected animals were dogs, cattle, and birds. For one-time exposures, when available, illness onset ranged from 15 minutes to 4 days. Veterinary medical care or treatment was provided to 6% or 25 animals. Gastrointestinal or generalized categories of illness were the most frequently reported for 380 humans and 92 animals. Generalized refers to constitutional symptoms such as headache, fever, or lethargy. These data help to illustrate that signs and symptoms for HABs exposures may be similar to other illnesses and therefore difficult to link to a HAB exposure. Now, most HAB events were classified as confirmed, human illnesses as probable, and animal illnesses as suspected, based on the state's review of the supporting evidence upon submission to OHHABS. Please note that HAB events are only classified as suspected or confirmed. For human and animal cases, it will be of interest to see how classification of future cases might shift as availability of diagnostic tests increases. Now, let's take a step back from the data and draw some general conclusions. This summary of OHHABS data from 2016 through 2018 represents the launch of national public health surveillance for HAB events and associated illnesses in the United States. It's a landmark step forward in better understanding the impacts of HABs on human and animal health. Looking ahead, we're planning to increase use and access to OHHABS data, including more routine and timely releases of annual data summaries. We're also continuously focusing on efforts that will support adoption and reduce reporting burden. We want to strengthen and expand the One Health partnerships that are so critical to all steps in surveillance, from detection through reporting and use of the data for illness prevention. A continued One Health approach to surveillance, alongside developments in the field, and increased access to specimen testing will improve the system as a whole. Now, please check out CDC's HAB-associated illnesses website to learn more about HAB exposure and illness and what you can do to protect yourself and loved ones from HABs. The website also includes a section with technical information about OHHABs, plus a section with health promotion resources, such as physician and veterinarian reference cards for cyanobacterial blooms. Several of these resources will soon also be available for download in Spanish, and printed copies of a pet safety poster are available to order for free from CDC. I want to thank all of my colleagues on the report that we discussed. They're here on the left in italics, and the many local, state, and federal partners who are too numerous to list in full, but essential to this effort. Thank you.